This video will demonstrate IV catheterization in small animal patients. Prepare your material prior to the procedure. Your tape, which should be appropriate length. Your syringe to flush and check catheter patency. Your catheter, which should be appropriate size, 18 gauge here for large breed dog. Your gauze. And your injection cap. You can peel off the packaging and unscrew the two parts of the injection cap so that it's easy to cap it once your IV catheter is in place. You want to do the same and remove the protective plastic cap, the container of the IV catheter. And you're going to separate the catheter and the stylet before replacing them in the original position. You do the same with the cap. This will avoid you difficulties when placing the catheter, as they can be difficult to separate the first time. You want to hold the catheter with your thumb and two fingers. Never touch the cannula. They should stay sterile as it will go into the vein. So you want to hold both the hub and the stylet together with your thumb and two fingers. You're going to prepare the site of catheter insertion by clipping the air and doing a full scrub, which we're not doing here. And then an assistant should be occluding the vein by placing pressure over the vein proximal to the catheterization site. You can stabilize the vein with the thumb of your non-dominant hand without touching the aseptically prepared skin. You don't want to touch the site of catheter insertion. With your dominant hand, you position the catheter with the bevel up at a 30-degree angle to the leg. Maintaining this position, you insert the catheter with one confident movement, and once within the vein, you're going to see a flash of blood in the flashback chamber. Once you see that, you angle lower your catheter to 10 degrees and you continue to insert a few millimeters. Then you're going to advance the catheter using your index finger until the hub meets the entry point of the skin. The stylet, which should have remained in place during that process, can be now removed. The assistant is occluding the vein immediately proximally to the catheter tip to avoid leakage, and you can place the injection cap. Never touch the end of the hub as you're going to contaminate this area which is directly connected to the vein. Then secure the catheter in place using the tape. If the limb got dirty with blood, make sure that you wipe the area using a swab to ensure the skin is clean and dry. Using the smaller tape, place a strip with the adhesive side facing up on the underside of the catheter hub with a tag of about 1 cm left to the side of the catheter. Fold the tag snugly over the catheter hub and wrap the remaining tape around the animal's limb. Then, under the hub and wrapping around the leg to continue proximally over the catheter hub, place another wrap of 1 inch wide tape. Then you wrap another 1 inch side piece and you just cross it from beneath the catheter up on the leg. Once the catheter is secured in place, ensure it's properly placed within the vein by injecting saline through the injection. Watch for subcutaneous leakage. And here you are.